Hi, my name is Charlotte Ross, and today I will be teaching you how to safely and accurately perform a barbell back squat. If you're not familiar with this exercise, this is a compound exercise that engages the hamstrings, quadriceps, and glutes as the primary muscle groups, which all work together to extend both the hip and knee joint during the lifting phase of the exercise. The erector spinae muscles, rectus abdominis, and the obliques are also engaged to provide support and stabilize the torso during the squat. Further muscle groups engaged in the lift are the trapezius and rear deltoids, which help support the barbell when placed on the back. Back squats are used for building lower body strength, muscle hypertrophy, and powerlifting. They also offer benefits in functional fitness, rehab, posture improvement, with many athletes incorporating back squats into their training programs to improve lower body power, explosiveness, and agility. This is useful in athletic performance during football, soccer, basketball, and track and field. Let's head to the gym so I can demonstrate how to do it.
Before I start my demonstration, there is a few safety protocols to run through first. We need to ensure that the bar is positioned approximately at armpit height so that the bar can be placed on the shoulders with ease. We have adjusted the safety bars according to the individual squat depth, and that squatters are available if needed, either one behind the squatter or two people on either side of the barbell if the weight is too heavy for that one individual squatter. Now, when placing the barbell behind the shoulders, there are two types of bar placements we could follow. However, for today's purposes, I will be going through high bar placement only, as low bar placement is typically used for much heavier loads and is more difficult for beginners. When performing a high bar squat, approach the bar at chest level and position the rack bar to a resting position on your upper traps. Press it into your traps while gripping the bar. Wrap your thumbs around it. Widen your feet shoulder width or slightly wider with your toes facing slightly outward. Keep your eyes facing forward and squeeze your back to press the bar down onto the top of your shoulders to keep it secure. With an upright torso and your shoulders away from your ears, slowly push your hips backwards. Squat with your core engaged and your back tight. Squat down, bending your knees, not letting them go over your toes, and try to sit as low in the squat as you can. When going in the upwards direction, try to keep your spine neutral without overarching or hyperextending your back, and slowly extend the knees as well as the hips, and safely place the bar back on those safety pegs, making sure it's secure before letting go of the barbell.
Upon observing the participants' performance, if they look like they're struggling to perform a back squat with an unloaded barbell, you can offer them a regression exercise, which can be known as a goblet squat. And that's just basically holding a dumbbell close to the chest and performing the downward similar movement to the back squat. This will teach them how to properly increase their range of motion and stabilize their position in order for them to eventually progress to a normal back squat. If they look like they're excelling in the back squat, you can offer them a progression exercise, aka a front squat, which is where the barbell is placed approximately on the shoulders to enhance their functional strength and lifting mechanics.